Good evening, everyone. I'm Maitri, your host for today's live session on managing respiratory issues in cold weather. Today, we have the privilege of having Dr. Nikhil Modi, a distinguished senior consultant in respiratory, critical care, and sleep medicine, joining us. Welcome, Dr. Modi.
Thank you, Maitri. It's always a privilege to be here.
Absolutely. With the winter season upon us, many individuals experience respiratory challenges. Let's delve into some insightful discussions. Dr. Modi, to start off, could you highlight how cold weather affects our respiratory system, particularly for those with pre-existing conditions?
Very important question for the time being, Maitri. So, as the winters have arrived, the weather has become cold. Cold itself, the cold air itself, when you inhale, it has a capacity to cause inflammation, bronchospasm, cough, and irritating symptoms like runny nose, sneezing, watering of eyes. Apart from that, as the winter arrives, this cold air, as when the air is hot, it tends to rise up. So it clears the atmosphere around us as the pollution rises up. While when the cold is around, this doesn't happen. Also, the wind speed is most of the time reduced. So this cold air accumulates there. The pollution due to that accumulates. So this cold air, apart from it itself being causing harm, the pollution which remains there causes more and more difficulty. And when we inhale this toxic air, you already must be seeing that the air quality index is so bad right now. When you inhale this toxic air, then the problem worsens. So all the respiratory illnesses like asthma, COPD, those patients who have them, they go into exacerbation in terms of increased cough, breathing difficulty, as well as those who don't have any respiratory issues, they can have symptoms due to that.
That's enlightening. Dr. Modi, for individuals with these conditions, what are some effective strategies to manage their respiratory health during the colder months?
So, as we are discussing that cold air itself causes the problem, so you have to protect yourself from cold. So, cover yourself adequately. Don't go out in too harsh a climate. Apart from that, the pollution, the toxic gases which we are inhaling, to protect them from them, we need to wear a mask. So when we are going out, we should be wearing a mask so that we don't get exposed to this pollution regularly and continuously. Apart from that, taking hot drinks, taking some steam cleans up our airways so that the pollutants and the particulate matters that can get deposited in our airways tends to get clean. Further, whatever medicines you are on, you should be taking them on time so that there is no problem. If you miss the medicines, then the problem can be much severe.
Great advice. I'm sure our audience is curious about specific tips. What exercises or breathing techniques do you recommend to improve lung health in winter?
See, firstly, any form of exercise definitely helps your breathing capacity. And apart from that, deep breathing exercises, some people who have lung diseases can use incentive spirometers, doing some amount of yoga, in which some yogas do tend to increase the lung use and lung capacity. So all of these can be done, but there is a catch too. If you are doing an exercise, I would say avoid doing exercise right now outside, especially early morning and evening times when the weather is much colder, when the pollution is at its maximum. So if you are going out, wait for the sun to come out, then maybe you can do it outside. Otherwise, do these indoor exercises for the time being.
That's insightful, Dr. Modi. When it comes to indoor air quality during winter, what steps can individuals take to ensure a healthy respiratory environment?
A very important question, Maitri. We always focus around the pollution which is outside, but if we do not maintain adequate ventilation at home and adequate sunlight is not coming to our rooms, the air which gets accumulated can be as bad as what the pollution we are seeing outside. So maintaining adequate sunlight, adequate ventilation in rooms is utmost important. Apart from that, those who have severe allergies, in some cases maybe an air purifier can be used. Though you have to be cautious, air purifiers is not the only solution for this air. They may help a bit, but they are not definitely the solution altogether.
Those are practical suggestions. Moving on, how does winter impact sleep quality, especially for those with respiratory conditions, and what can be done to improve sleep?
The cold weather can definitely harm your sleep. Those who have allergy tendencies, due to the cold exposure, their nose gets blocked. Due to nasal congestion, when you are sleeping, you are not able to breathe in properly. If your breathing issues are there, we do see that in the night time, the breathing problems, especially in asthmatics, worsen. So due to that, they have constant cough and they are not able to sleep properly. So any local congestion leading to nose blockage, a throat irritation, a cough, or worsening of your symptoms definitely hampers your sleep quality. Lack of sleep further puts your body into a stress, and further your disease can get aggravated due to that.
Valuable insights, Dr. Modi. For our viewers, could you outline emergency measures or signs to watch out for in case of severe respiratory distress during winter?
Yeah, so to start with, Maitri, I would like to say, if you have breathing issues, don't wait for emergency signs to come in. If you are a patient who have respiratory issues, please be on your regular medicines. If you are not a patient who have developed new symptoms, go to a doctor immediately. Don't let it worsen to an emergency state. Still, if a case arises that you develop some emergency symptoms, any sudden worsening of breathing difficulty, a cough which becomes uncontrollable, if you start developing a fever which is a sign of a new infection, which can be a sign of beginning of pneumonia as well, in any of these scenarios, or if you notice that the oxygen is going down, in any of these scenarios, please report to a doctor immediately on emergent basis.
That's crucial information. Now, considering COVID-19 concerns alongside winter, are there additional precautions individuals with respiratory conditions should take?
See, apart from COVID-19, I would say with winters, there is a risk of many different infections to come into your body. COVID-19 is just one of the virus. Apart from that, influenza virus, which we have seen one of the strain H1N1 being deadly some time back. Apart from that, adenovirus, multiple other viruses can cause respiratory illness. You can acquire pneumonia because of the sticking secretions which may accumulate in your lungs due to a bacteria, and any form of infection can be much more common as compared to any other time. And so that's why we should be taking utmost precaution of taking medicines on time. Again and again I'm emphasizing on that, and wear a mask so that even if you come in contact with a person who is having this infection, you will not get hold of it, and then you can protect yourself well.
Thank you, Dr. Modi, for your valuable insights and practical advice today. Before we wrap up, any final tips or message you'd like to share with our audience?
Yeah, thanks, Maitri. To end this session, I would say this weather is definitely harmful for those who have respiratory issues. Please wear a mask, take medicines on time, do exercise regularly, eat healthy, and protect yourselves from infection. In case of any worsening of symptoms, immediately consult a doctor. Timely intervention can save lives. Thanks a lot.
Wonderful advice. That concludes today's live session. Thank you, Dr. Nikhil Modi, for sharing your expertise, and thank you to our audience for joining us. Stay safe and take care. See you next time.